the get-go, try to bring it up to date.
Any questions? All right, thank you very much. Motion and support. All in favor, signify by saying aye.
Aye.
Any opposed? Motion passes or moves forward. Item number 5, other agenda items.
Mr. Chair,
Yes, sir.
could we get a report from the county clerk on our recent election last week and what the current status is? 'Cause I know the election was close, and maybe you could share any problems or anything, how smooth it went, et cetera, et cetera.
It went pretty smooth. The only discrepancy was on the web. It said 8 precincts and there were really only 7. But at the time when I was finalizing everything for the Bureau of Elections, Perry Township was split into 2 different precincts and they really only had to be under 1. So that change could not be made to reflect 7 and 7. I mean, we didn't realize that until the night of the voting, but that's the only discrepancy. People kind of were saying, is it 100% done? Went very well. Lanesburg's sinking fund passed. Perry's sinking fund failed by 1 vote. And our canvass was completed today. And Perry's superintendent dropped off a recount request. And so we have that scheduled for Tuesday of next week at Perry Township Hall. They're only requesting the city of Perry and Perry Township to be recounted. So the calculator of number of ballots and the differentiation in votes is 3 for one and I think 2 for the other, for the city. And if there's something awry there, it can change the outcome of their election. So, looking forward to
Okay,
that.
so what happens if it's, I know how this works for candidates, but what happens on a tax proposal like this if it's tied?
I think it fails.
Is that what happens? It's not, I mean, you can't draw straws, you can't flip a coin with the ghost, so.
I was reading so much over the weekend, I think it fails. But they have enough time to get it.
They have to pick up 2 then.
They have enough time, if it does, to put it back on the ballot for August. My deadline is August 8th, is May 16th. No, they wouldn't, so there we go. I'm losing my time in lunch.
Thank you.
Anything else? Any other agenda items?
With the other townships, everything was smooth?
Yes. Do you want me to say about that?
No, that's all right.
New Haven had the Bureau of Elections put on their site that New Haven voters were to go somewhere else to vote. I don't know where they got that from. There was 3 jurisdictions involved with New Haven, and one was going to Maple Grove, one was going somewhere else. But they told those voters to go somewhere else on the web.
No, that was Hazelton was supposed to come to New Haven, we closed Hazelton. That's the way it was supposed to be.
And,
They didn't have it that way.
and that was not me.
Wouldn't be the first time the Secretary of State had stuff wrong on the website.
Hazelton, instead of having 2 precincts open, the Hazelton was supposed to go to New Haven, but they, on the website, they haven't known that Hazelton was closed, so it was all. Because I live in New Haven, so I found that out.
Anything else?
That's good.
Okay. Call to the public, final call to the public for this meeting. Anything? Hearing none, meeting adjourned.
Mike, you yelled at me, so I'm not going to talk to you.
No, I just, yeah, just like. Because
No
of my-
excuses now, I understand.
Because of my own mess.
I did it.
You paid for it.
Yeah, I was wondering.
In the back seat.
I can't see
You and Gary. Oh.
You know, I think one of the things briefly confused.
There was some briefcase in the back seat. And I know
I mean, those are meetings.
Yeah, that was very interesting.
How do you do that?
He's for our.
How do you move this one?
I mean, I know better, but my mind was someplace else. But that is confusing. Because I read these agendas and I think,
Royal really, when I get the word, yes, I did.
I couldn't get it to move up and down, so I didn't see that little thing on the side there. So then the building across that way, what is it gonna do, go away?
Some of the architects said I
Another on YouTube.
Well, I just don't trust them to do it. They check it was on that versus what we said.
you don't stop. You know, you talk about the change, you talk about change, you talk about change. You continue with what's the same. And he wants to.
Phone protection.
Keep functioning. And we should have pointed it out. We talked, he called, we talked that way.
And Gary Anderson was talking to me.
I know he did.
I think it's,
We think is most common.
6, 8 hours traffic all driving. Not me. No, not a whole lot. Funerals today. Once it was on nice. Did 6.
I would be more comfortable.
So I was
I mean, they let somebody new on? I can't believe that. Gee, let's stop.
That's a good thing, I understand where you're coming from. Because one of the funeral directors out there, he got out of the car this afternoon, first time he's been out all day. And first thing he says, what the hell?
That's the only thing.
They're fake news. Sample our whole.
Let's call to order Health and Human Services Committee. Will everyone please rise for Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call to the public. Do you not have anything? Is there anything that's been handed in yet?
No.
There wasn't anything to.
Okay, item number 4, consider accepting and placing on file the Health Department's 2016 annual report.
He didn't have anything to sign in with.
You want me to back up, or do you want to do it at the end of the meeting?
I'll go with you.
Okay. Okay, item number 4, item 4, 5, 6, and 7 is all gonna be Larry. Do you wanna,
Come right up.
actually, I need to do the motion.
I'll make a motion.
Okay, is there support? Support, okay.
Wake up.
I'm sorry, everyone to my right.
This one.
Larry?
Thanks. Just presenting our annual report. We did a major redesign this year. First time we tried to come up with something that we thought would be easier to read and something that people would want to look at, as opposed to the stack of papers I gave you for the last few years, just tracking our numbers. So we had this put together. Our staff puts it together, but we had a graphic designer give us this nice presentation. A couple of the highlights I'd like to just kind of focus on in there on page 2. Last year, we received our accreditation from the state of Michigan. Obviously, it was a great thing. First time in department history, we got a perfect score. You know, that was hard to do, and that says speaks to the efforts of our team, our staff. You can't do it without good people, and we got a great team at the health department. A couple other points I want to talk about real quick that I'm real proud of are increase in immunizations. 20% increase in general immunizations that we gave this year, and we also had about a 20% increase in our restaurant inspections. So we're a high-performing county department, delivering quality health services to our residents, and we're proud of it. And I'm proud of my team. And I'd like to thank this board and our Board of Health, Commissioner Bruff, Commissioner Marks, and last year's Board of Health members who were a big part of this. And those two gentlemen are sitting right here, glad they're here today. So
Waiting for our donuts.
they're coming now. You're too late on that. But anyway, if anybody has any questions on the report, I know you got an electronic copy.
I have a question. You said the immunizations are up 20%. So
We gave out 20%, we administered 20% more across the board general vaccinations than we did in
okay,
2015.
what percentage of our children population are all up to speed on immunizations in our county?
Well, there's a number of different categories for that, and I can provide you exact data, but they're rated for babies to like 2-year-olds, 2 to 17-year-olds. I would say the range is anywhere from 75 to 95%, depending on the category. As you're aware, in order to go to school now, for kindergartners, you either have to be vaccinated or you have to complete a waiver process through the health department. And since we've been doing that waiver process, we've managed to decrease the number of non-medical waiver exemptions, which is important because
So
before it was
the process
convenience.
is working.
Yeah, the process is working.
Okay.
Before it was convenience for people if they didn't want to do the vaccines. A lot of them just didn't want to come down to the department. Well, now it's not so easy. And that's really important because we're seeing a resurgence of some diseases that were eradicated.
And there's an effort right now to do away with the.
There's an effort at the state legislature, but Governor Snyder has come out against it. And without a majority to override him vetoing that, thankfully, that's not going to go anywhere.
I was at a Capital Area Community Services Board meeting a week or 2 ago, and they had this huge Head Start report that they did. In our county, out of the 4 counties, via Head Start, we had the highest rate of immunizations compared to Clinton, Eaton, Ingham, and Shiawassee. We were at the very top, so probably matches.
That's good to hear.
We were 96%, I think, on average for Head Start kids.
Yeah, and those are the preschool ones. Good. Good. Any other questions on the report? I hope you like it. I've got some copies. Need a few over here.
Nice and colorful.
It is, yeah.
You can't afford that over here.
It's actually pretty reasonable. But anyway, we're proud of it. So.
He, diversion tells us about your new communication equipment.
Well, yeah. So we invested some upgrades in technology for the Capitan conference room. The second floor conference room is now compatible with the EOC. It's directly wired into the EOC. We put in a couple new flat screen televisions and a smart board for our presentations. And what a smart board is basically, you get your projector and your PowerPoint. Well, in the old days, you'd stand there and do a clicker or you'd hit the thing. In the new days, you stand up at the whiteboard, it's interactive, and you just touch it. And it changes the slides, you can draw on it. I mean, so many schools are using it. So it is now the most technologically advanced conference room in county government.
And it's also,
Until they build a new, then we might not be.
but you can do that throughout your building.
Yeah, it's really neat.
So people can actually be.
So
on
if you're in the
floor.
basement, you can see what's going on the second floor. If we had a major crisis right now, and we had to have everybody in the EOC, we could use overflow in our conference room. And we used emergency preparedness funding to pay for that. It's good. I encourage you to come check that out.
And then the football games.
We don't have cable TV available on that yet.
March Madness. Okay, we have a motion of support. All in favor, say aye.
Aye.
Opposed? Okay, motion passes. Number 5, consider authorizing a contract between the Shiawassee County Health Department and the Shiawassee Regional Educational Service District for social work services in the maternal infant health program in the amount of $60,000 for the period of May 15, 2017 to May 14, 2018, and authorize Larry Johnson, Health Director, to sign all necessary documents. Do I have a motion?
So moved.
Support? Discussion.
Okay, so this is a new contract that we've got with our friends at the RESD. We've got a number of contracts with them, public-to-public partnerships, and the RESD has an advantage that they hire social workers, teachers, different individuals. And we have been without a social worker in our maternal and infant health program for 9 months, and it's been hurt. And that is a program where nurses and social workers do home visiting to our pregnant moms and moms with babies up to about a year to 18 months. And that social work component is really important. And we don't have to get into what we've seen in the paper with some cases in this county that are very unfortunate. But we feel that we had to get someone, we couldn't find anyone. Finally, we found someone, and rather than hiring them as an employee of the county, we're contracting with the RESD, so we're not carrying any legacy costs on that. Not to say that I may not have to go back someday to having an on-staff social worker, but this is giving us full-time social work for that program, and we're contracting with the RESD. And we were fortunate because this individual we got is a licensed master social worker. And those, man, I'm telling you, it's hard to get nurses and it's hard to get social workers right now. So, I think that says something good about the economy, but we need to get it going. It is one of our largest programs, and on your report, it's on page 17. It kind of gives you a little explanation in more detail about the maternal and infant health program. So, excited to have this person come aboard, and we move forward.
Any other discussion? All those in favor say aye.
Aye.
Opposed? Motion passes. Number 6, consider authorizing a contract amendment between the Shiawassee County Health Department and the Michigan Department of Environmental Quality for environmental health services in the amount of $35,032 for the period of October 1st, 2016 through September 30th, 2017, and authorize Larry Johnson, Health Director, to sign all necessary documents. Do you have a motion?
Motion.
Support?
Support.
Okay, discussion. Larry?
This is a current contract that we have, and throughout the year, with some of our state contracts, we do routine amendments. The amount either goes up or down. In this particular case, the amount is going up slightly, and we are realizing some increased revenues in our land application of septage waste program. And what that is when you get your septic tank pumped, if you don't have a facility to take it to, such as a wastewater treatment plant, it gets land applied. totally legal, has to follow all the laws, and that septic gets incorporated either within 6 hours if it's supplied on the face, or it's injected immediately. And some people don't really realize that your waste has to go somewhere, and you are supposed to clean your septic tank every few years. So we got a little extra money in that. We're excited. Anytime they want to give us a little more, glad to take it. Any questions on that?
Okay, all in favor, say aye.
I
Opposed? Motion passes. Number 7, consider authorizing a contract between the Shiawassee County Health Department and the Great Lakes Commission for River Cleanup Grant in the amount of $5,992.50 for the period of March 30th, 2017 through September 12th, 2017, and authorize Larry Johnson, Health Director, to sign all necessary documents.
So moved. Support.
Okay, discussion. Larry.
Yeah, this is one of my favorite projects at the health department. This is the annual river cleanup, scrap tire collection. Now for the 10th straight year, the Great Lakes Commission and the DEQ have found our program worthwhile to fund. And that is really rare to get funding 10 straight years for a single grant program. And it's about $2,000 in grant dollars, and it's about $3,900 in match for doing that cleanup. That's going to be the last Saturday in July. I don't have the exact date on that right now, but last Saturday in July will be the cleanup. Great community event. Some of you have been to it before. We meet at Oakwood Bridge in Owasso, just by the Kiwanis ball fields, 9 a.m. And then we have a team that meets at McCurdy Park. And then from there we fan to different sections of the river. And in the last few years we've had a record turnout, 125 plus individuals, and we've cleaned stretches that we hadn't got to before. And now what we are starting to see the results in this river cleanup is that it's cleaner than it's been since, many, many years. We're getting the debris out of there. A lot of positive things with the river. It doesn't always get that positive publicity when you have a sewer overflow or something that's out of our control, but there's a lot of good in that river, and that river is probably cleaner than it's been in 70 years.
Now, is that Friends of Shiawassee River? They help
Yep,
out with
Friends
that?
is our partner on that.
And anyone else or just them?
We get matched from Waste Management for a dumpster. Mancino's provides free sub sandwiches for an after party at the amphitheater. Chef's Canoe out of Byron provides canoes free, up to 6 canoes. So we've got a number of different entities that kind of support that coming together, that community event.
Any other discussion? Okay, all in favor say aye.
Aye.
Opposed? Motion passes. Other agenda items? Anyone have anything? No? Call to the public. Matt Shepherd.
A comment has been made that the Veterans Affairs Committee would be investigated through hearings. Many signatures, over 500, as you might recall, were taken. I hope we feel that you don't feel yourselves that that was a waste of our time collecting those signatures, as I will devote much more of my time to collect signatures on recall ballots. If you think it's a joke, then just keep pushing. That's all I got.
Next, we have Les Schneider.
How you guys doing today?
Good.
Got a couple of quick questions, answer if you want, or I'll catch you afterwards and twist your arm and get an answer to that. Either way. I've been missing you guys over the last few months as we've been trying to get together to go over the information for the Veterans Affairs Committee. I understand Jeremy and Dan have been coming here on Wednesdays.
Mike.
Mike has been coming here on Wednesdays?
Hard to believe, huh?
Are you going to be here tomorrow, Mike?
I can't be here tomorrow.
How about next week?
Yeah.
Okay, I'll see you then. I've talked to before, and
I'll look at my calendar.
okay, that's cool. All I'm trying to think of is can't catch the three of you all at one time, then I'll catch you independently, and then you guys can chit chat and decide which way you want to go. All right? I'm not nearly as difficult as believed. Although, I do have something to address to Larry over there. If you, go to the middle of it, it's the annual report, the part where the staples are. What other publication is famous for having staples and not having a picture here? What the heck?
Are you referring to the raccoon?
If you want more people, you want more people to read this thing, you gotta have some kind of a draw. People of the county or something.
pictures.
I've been hanging around a bunch of Army guys. They want more pictures. Okay?
Less words.
Yeah.
Some people's kids. And of all people, you caught it right off the bat. Thanks.
Thank you. I am still, probably in a week or two, I'll come up with a schedule for the hearing stuff. I'm still trying to do some research on my own and get up to speed on a lot of the different issues, so that will be coming minute and less.
Okay.
So, anyone else for call to the public? With that, meeting adjourned.